Well, to tell us more about EPOS4Patients, I'm delighted to welcome Professor Claire Hopkins, who is Professor of Rhinology at King's College London and the President of the British Rhinological Society. Professor Hopkins, thank you so much for joining me. Let me ask you firstly, how did the EPOS experts develop EPOS4Patients?
So we were very mindful, having developed EPOS, that we needed to put it into a manner that was accessible for patients. We're increasingly aware that patients need to be involved in decisions about their care, and they can only make that if they have a good understanding of all the different treatment options. And so we set out with a group of experts to involve patients in developing a manual that would really answer the questions that they felt to be important. We have separated into all the different treatment options available, and for each chapter, patients have directed what information should be included. They've helped to make sure that it's presented in a patient-friendly manner. And they've also included the questions that they would often want to ask their doctors, but often don't find that they have the time to do in a busy clinic. So we've tried to address all of those in EPOS4Patients.
Well, it sounds like a fantastic resource. I guess the proof of the pudding is in the eating. So tell me, what is the feedback from the patient groups?
Well, feedback certainly from my own patients has been really positive. Again, there's often not enough time to cover everything to the level of detail that patients would like now. So they find it very helpful to have something to take home, to reinforce the points that have been discussed in clinic and give them more time to think about all the different options so that they can make a decision that is right for them.
And finally, how will the European Rhinological Society disseminate the information on EPOS4Patients to the community?
Well, that's actually the greatest challenge, and we're very grateful for the opportunity to work with EUFOREA to help disseminate. All the clinicians involved are giving it to their own patients. We're using social media forums, for example, nasal polyp groups, to try and disseminate. We've worked with patient groups such as Absent and Fifth Sense that deal with patients who have lost sense of smell, and many patients with nasal polyps will fall into that group, of course. But we need to get the information more accessible to more people. So we're exploring other forums with which to do that. So certainly social media, patient groups, and beyond, really.
Well, thank you very much indeed, Professor Claire Hopkins.
Thanks for your time. Bye-bye.